Today's discussion is focused on the Wizard of Oz. So where does the group want to start the discussion?
I think Dorothy would be a good character to start on because I feel like the whole movie wouldn't exist if she wasn't having this like kind of delusion or whatever it is of like her family members and friends being reflected in like Oz, like this world she's created after getting hit by the window, right? She was like hit by something and then she started, I guess, hallucinating or whatever it is.
Okay. So you mentioned delusion. What evidence exists in the movie that we're observing a delusion? And Wendy Gale, is that right? We're on Wendy's case. You think Wendy's the main character?
Or Dorothy?
I'm sorry. I'm getting Wendell as my shining slip. Dorothy, I'm sorry.
Yeah.
So, what evidence suggests that Dorothy is struggling with the delusion?
I would say it's like a fixed kind of view, especially at the end when she's like coming out of it and she's still like adamant that this happened and that she was like in this place and that these people were there. So I think the fixedness of it is pretty fair. It's literally a thought process that she has, and people around her like disagreeing, not believing it. And I think it's pretty like grandiose in terms of like the world she's created. So I think that plays into why it could be a delusion.
And I was going to ask, and you actually had a leading answer into this. What theme of delusion do you think takes place?
Grandeur.
Grandiose? Anybody else?
Some like persecution too, from the witch. But
Yeah.
as well.
Now the DSM, the DSM-5 does allow for mixed type. So, I mean, you're both right. By the way, what are the other themes?
Of delusion?
Yeah.
Erotomania?
All right, so erotomania.
Erotomania.
What if you were to talk to the writer producer, what would you have written to the script to demonstrate the erotomanic type of delusion in Dorothy?
Yeah, that's what you would write in, right? That's some love interest. She was saying she didn't have a love interest.
Any particular?
An unrequited love interest.
You guys are gonna leave it
They
generic?
have the three who are with her the whole time, like in love with her, right? Like the Tin Man,
Yeah.
the Scarecrow, and the
She has like a
Lion.
particular fancy towards the Scarecrow, her favorite, right?
Yeah.
Interesting. Have you seen Wicked?
Right. All right. What other themes?
Oh, we said persecutory, right? Grandiose persecution.
Jealous.
Jealous type. All right. And one more. Somatic.
Somatic.
Right. But in this case, probably mixed. If this is ruling in, I think one of our chief within a differential would be delusional disorder. What other signs or symptoms will you now investigate to differentiate from schizophrenia?
Hallucinations, disorganized speech, and negative symptoms like flat affect, anhedonia.
Right. And really, evidence of any one would suggest schizophrenia and not delusional disorder. You wouldn't diagnose both, right? If the delusions are in the context of a larger condition, you're going to diagnose the larger condition, and that's schizophrenia. Differentiate for me schizophrenia then from schizoaffective, and then do you think that Dorothy is ruling in for schizoaffective disorder?
Like coinciding mood disorder, like the symptoms of psychosis and hallucinations, and then either like depression or mania, and then making sure that they don't overlap.
They do or don't overlap?
No.
They can overlap, but then you have to have psychosis without overlap of mood symptoms.
Right. And what if you had mood symptoms without evidence of psychosis? What then?
Okay, mood disorder, right?
Yeah, right, yeah, right.
Yeah, if there was.
Yeah, and that's a clinical pearl that is almost definitely going to come up on your shelf exam. You're going to have a patient that presents with co-occurring affective and psychotic symptoms. And choice one is going to be schizoaffective. Choice B is going to be primary mood disorder with psychotic features, right? And the easy way to state this is that when you have evidence of one without the other, obviously you've uncovered the primary illness, right? So schizoaffective, there is a window of time in which the individual will demonstrate psychotic symptoms absent the affective symptoms. Primary problem is is psychotic, and therefore schizoaffective disorder is your single best diagnosis, right? The opposite is true for the primary mood disorder. When you take a patient history and you suspect a primary mood disorder, severe with psychotic features, when are you most inclined, or where are you most inclined to look for that evidence where there are only mood symptoms or affective symptoms, whether they're depressive or manic, in the absence of those psychotic symptoms?
When young,
When young,
like teens.
potentially.
Stressors, like periods of stress.
That sure. Generally speaking, it's in the beginning of the episode.
Oh, okay.
Right, in the beginning of the episode. That is not true for schizoaffective. Schizoaffective, that 2-week window, and the APA does require 2 weeks. If a person tells you, yes, voices and delusions, however, this particular stretch of time over breakfast, no mood symptoms, that doesn't buy it. It's got to be at least 2 weeks. And that could occur anywhere within the episode of schizoaffective disorder. That's usually not the case for primary mood disorder. What is the point prevalence of psychotic features in someone with major depression?
1%.
Oh. Yeah, 10 to 20. Yep, 10 to 20%. Point prevalence of psychotic features in someone with bipolar 1. Yeah, 50. Right? Very difficult to tease out primary mood disorder from schizoaffective. But on the shelf exam, hopefully it's easier because the question writer is going to try to test your knowledge of exactly what to look for and sometimes even where to look. Right. Any questions about the differential between schizophrenia, schizoaffective, and primary mood disorder? Any one of these higher on your differential for Dorothy?
I was not going to argue that neither because of the time period that she's experiencing this. I feel like we'd be looking at brief psychotic disorder, if anything. Also considering the stressor of like starting it being her dog being taken away. That's where I would go with the differential. But
What's your time frame for brief psychotic disorder then?
less than a month, right?
Right. So 1 day to 1 month.
The only thing too is that we know Dorothy's parents have passed, and like there seems to be like some other underlying issue. And I'd be curious how long she's felt depressed. Like we know she was for sure depressed that day, but we don't know if there was depression before that.
Yeah, that's a good point.
So then like MDD, like a psychotic,
Right.
now that we introduce a second stress.
Yeah.
Potentially.
Yeah. So we need the prequel.
Mm-hmm.
Yep. Continuing with the schizophrenia spectrum and other psychotic disorder chapter or differential, if an individual demonstrates signs and symptoms of psychosis between 1 day and 1 month, how can you tell whether it's brief psychotic disorder or nuanced schizophrenia that you just happen to discover very early in its course? This comes up on exams.
Doesn't schizophrenia sometimes there's like a prodrome of if like you gave an example earlier, like somebody in graduate school, somebody in
And then it must be true.
yeah, grades are falling, or it seems like depression. Whereas with pre-psychotic, I don't think you have that.
Correct, and it's more of what you pointed as a stressor. It's usually the reaction to a stressor. Let's say, unfortunately, neither the stressor nor the prodrome is provided to you in the case vignette on your shelf exam. Age, potentially. Negative symptoms.
Oh, okay.
Okay? If the brief psychotic episode, not the disorder, but if the brief psychotic episode includes negative symptoms, you're most likely dealing with schizophrenia that has been caught very early in its course. That's a poor prognostic indicator. Right? Negative symptoms are not part of the diagnosis of brief psychotic disorder. Okay. What are some examples of negative symptoms? What are some of the things now that you're going to rewatch The Wizard of Oz and look very closely at the character of Dorothy as to whether or not she demonstrates these or not?
Flat affect.
Evolution.
Anhedonia.
Okay. So these are the 5 A's. I heard 3.
Thought accomplishment? Does that count in one of these?
Anorexia.
I'm sorry?
Anorexia.
Anorexia. This is when you guys really impress me upon how many words you know that begin with the letter A. It's like a mocha test.
Apathy?
Apathy?
Does that count as the other ones?
Yep.
Oh, elogia.
Nasalish.
Elogia.
All right, good guy. Good job.
Nice catch.
This is like remembering grammar.
Gotcha. If you go by the second letter, it spells plant.
Okay.
All right. So I heard apathy. I heard elogia. The third A is the A, right? The A in plant is the A. That's affective flattening. I heard anhedonia, and the last one is attention deficit. All right, so that's the T. So if it goes by the second letter, with one exception, it does spell the word plant. It's much easier to remember.
Is attention deficit on my clinical exam difficulty attending to the conversation, basically? Is that
Yeah.
how you determine it?
Yeah.
I feel like it's confused sometimes with like disorganized speech and
Oh.
like
Yeah.
tangentialness, but.
Okay.
Any of these demonstrated by our main character? No? All right. So maybe more in line with brief psychotic disorder than schizophrenia. Whether or not they are, what if the time course goes beyond 1 month? Then what is added to your differential diagnosis?
Schizophreniform.
Right. Right, schizophreniform. And what's the time frame for schizophreniform?
1 to 6.
Got it, right. And then 6 months or greater is schizophrenia. And that would be schizophrenia, rule out schizoaffective, depending on that affective component. All right, what questions do we have with regard to the schizophrenia spectrum and other psychotic disorders? Where are you leaning with this character?
In terms of diagnosis?
Yeah, I mean, in terms of most likely diagnosis.
I was going to take it to the brief psychotic.
You guys to brief psychotic disorder?
What about, I mean, it's maybe more metaphorical and not literal, but like, what about like drug-induced psychosis that Bobby feels?
Yeah.
Yeah.
Yep, so that's in a differential diagnosis. So before we can validate our most likely diagnosis of a mental disorder, we have to definitely investigate any potential organic etiology, including the direct effects of a substance. So what are the five substances that can induce psychosis? Well, it's like 5.5, but I'll give you 5 here.
Like amphetamines,
Amphetamines?
like cocaine,
Mhm.
Yeah.
Opioids can't. Yeah.
hallucinogens.
Yeah, which is why this might not be, right?
Glucocorticoids.
I'm talking about recreational drugs. Don't talk to me.
Psychedelics?
Huh?
Psychedelics.
Hallucinogens.
Yeah.
You said like PCP and
Is canthions like hallucinogens? Or,
Mhm.
yeah.
Well, that would be stimulants.
Stimulants, sorry, yeah.
So far with all I got down here is stimulants and hallucinogens. After all this,
ketamine, maybe?
huh?
Ketamine.
Hallucinogens,
Sedatives? No.
sedatives. Yeah. And if sedatives can do it, what else can do it?
Alcohol.
That's why that's the 5.5, right? Because those two I put together.
Together?
Yeah.
Just on the same one.
I think
Two.
there's in 2.
Have you heard of cannabinoid? Like.
Yep.
It's like, yeah.
I'm still 1 now.
Is the other one like an anticholinergic? Something
Nope.
Like
Maybe-
We have stimulants, psychedelics,
Yep.
hallucinogens,
Hallucinogens are psychedelics are hallucinogens.
sedatives.
Sedatives and alcohol,
that?
cannabis. No. Hint. Anybody see Little Shop of Horrors?
Yeah.
I got a couple of yeses. It's definitely manifest or demonstrated, depicted there. No?
Like rat poison?
Like a plant? What?
No, the dentist.
Oh. Oh, like
oh,
inhalants.
Inhalants.
Yeah.
Yeah. Okay. So, where are my true horror buffs? Who has seen Paranormal Activity? I only got a 1, huh? Yeah. Too scary. Well, the main character in Paranormal Activity, at least the original, is Micah. And you could make, not an easy argument, but you could certainly build a differential that he is psychotic. I mean, he's the one holding the video camera. He's the one that believes his house is haunted. He believes that he sees things, footprints. There's an element of psychosis. Similar type of case formulation, might it be substance-induced? Now, there are no substances that are depicted in this movie, unlike The Wizard of Oz and the Poppy Fields. So it isn't that straightforward, but borrowing from his name And just the idea of having to go through this differential diagnosis, MICAH, that's an acronym for the substances that you just named that can induce psychosis. The only tweak here is that the M is methamphetamine and other stimulants. Otherwise, I, inhalants, C, cannabis, A, alcohol, and H, hallucinogens.
Well, that wasn't on purpose, right?
I don't think it was on purpose, no. I don't think Orrin Pelly never called me.
That's the wild.
We got?
I said that's the wild.
Now it's time to watch it and get to know that character, and we'll never forget those 5 substances, right? All right, back to The Wizard of Oz. What else are we looking at here? Even continuing even through Dorothy's eyes. Anything else?
Hints of separation anxiety with Toto. Or is that a 2 out of
Dependent.
Oh,
Like what? Dependent personality.
How so?
It could be reactive attachment too. She's
Yeah,
had
I don't
trauma.
know.
Yeah, I mean, the head trauma is a big player here.
Yeah.
This is all due to head trauma until proven otherwise. There's no way you can convince me that her getting that window to her, yeah, this is all TBI. So with that as that organic etiology, even in the absence of opium and other opiates like heroin, we have to consider this to be due to brain injury.
But I was thinking before the brain injury, she's very upset about Toto, and I think that could be like a potential reactive attachment disorder from her like loss of her parents early on. It's more of a child diagnosis, but
Yeah. Oh, she is
she's
a
a
child.
child,
Yeah,
so
she's a
yeah.
child.
How
She's
old
a
is
teen. I think she's supposed to be like a teen.
Yeah, I think she's supposed to be a teen.
Yeah.
She's probably a little older. I mean, she's definitely a little older when she started, but yeah.
But is like adolescence too old for reactive attachment?
Yeah,
Yeah, it would be a little bit.
yeah. It's probably, you're probably,
If I'd be PTSD at that point.
yeah.
I think she sometimes splits.
Mm-hmm.
Because I was thinking back and none of the characters were really morally gray.
Mhm.
They're always like the witch, she's like, are you a good witch or a bad witch? I didn't know they were good witches. And like she seems to reprimand a lot of people a lot until she realizes, oh, they did one good thing and now you're good.
Mm.
Like I guess the wizard himself, she's like, shame on you. I thought you were a good wizard. So I maybe some signs of like borderline.
Definitely developmentally not at her age range, like just the way that she perceives the world. No like social friends that are with like inappropriate age ranges either that we know of. She's like very like atypical for a teen.
Yeah. Yep. I want to talk about her splitting those witches, though. I think you're onto something big here. Anybody have any more with regard to case formulation and how she views Glinda versus Alphaba? I mean, we're going to assume they're not real witches, right? Because if she presented to us, if you're on call with me over the weekend, then we get this case, and you come back to this room, present this case, and say, no, there's 2 witches. One's a good witch, one's a bad witch. I'm not so sure the clerkship's going to go all that well for you, right? I want to hear a little bit more of a case-based or an evidence-based angle on this. So what might be the derivation of this? And is there any kind of reliability in terms of anything else you've seen, especially fictional? Why would she split like this?
Well, I guess it's kind of in reaction to what either witch did to her. Like she, like the bad witch tried to take away her dog, so immediately bad witch, no coming back from that, which is kind of, I guess, the splitting. But the same thing with Glinda. It's like she did something good once, and now immediately she's a good witch.
Okay.
Trauma eventually.
Yeah. Yeah. Keep on going.
Oh, we know Toto bit the lady. We don't really know why. So I do have some questions about like if something else happened.
Think it's
before
rabbit?
then. Maybe it could be. Could be rabies. Could be a connection to our science office. Though.
Could be. When growing up, there's a point in time where paradise is lost for us and our perfect parent is deemed to be imperfect. That's a discovery for all of us. If you want to use the T word to describe that being traumatic, it's normative, it's universal, but it happens to all of us. There's a time where mom and or dad was the epitome of perfection, and there was one moment in which that was gone. That was gone. Some people can tolerate that. And if splitting happens to be a defense that is used at this age, and it's random whether or not it will be, if it is, you can actually create an imaginary friend. That defense mechanism called fantasy. An imaginary friend, then through splitting, embodies and imbues all the negative characteristics of mom or dad. Usually it's mom. And therefore keeping mom perfect. That's alphaba. Right? That's alphaba. And this connects directly to what we were talking about previously, about that prequel. What happened to her parents? And is the answer to that, and we don't know, but is the answer to that at all tied to the reason why she split and had to come to grips with why mom is so imperfect? And that's the question here. Have you seen this before? Where have you seen this before? Because you've definitely seen this before. Every evil stepmother that Disney has ever created. All those princesses didn't lose their mother. Matter of fact, in the source material, in all the folklore that Disney took and repackaged, it's the biological mother that has the issue with Snow White and those other princesses. Disney changed it to the evil stepmother. And he wasn't wrong in as much as he just took it to the next level, probably unbeknownst to him. But biological mom is still alive and well in those tales, but imperfect. And the princess splits, and in her mind, fantasy, defense mechanism, creates the evil stepmother motif, including alphaba.
Even like the ugly is evil and the beautiful is good mentality is very like evidence splitting to use that a lot in Disney. Whereas like the evil ugly stepmother, the ugly stepsister, so it's always like evil associated with like ugly, or in this case green, right?
Mm-hmm.
Which is also a common motif in Disney movies, like green is often the color of like the evil guys.
Mm-hmm.
And the good guy is beautiful. Up until she says to Gwen that you're so beautiful, you're so good.
Yeah.
Very interesting.
Always connected.
Yeah.
Where of course they're neutral. There's nothing. One does not confer the likelihood of the other. Any questions about this character moving forward?
Just connection to the Broadway musical Wicked, the song that had been changed for good. I just thought that was nice.
Yeah. Now, if you want to go and write this up as a case study, that is The Wizard of Oz, then go see Wicked and write that up. The big question is, why the switch? You split initially one way, and then your case is told, the patient's self-report is the direct opposite. That gets a little wacky. And I don't have a great answer to that, but boy, would that be an interesting case discussion.
I don't remember the exact plot of Wicked, but I think there was some kind of other common enemy, so maybe that's why they split.
Actually, it's like the same kind of ending. The wizard was really the bad guy all
Mhm.
along.
Yeah.
And that's kind of what Dorothy figures out too, that the wizard's really not all he's cracked up to be.
Mm.
But in Wicked, Dorothy's more like a victim of the games of the wizard versus like the main character. She's like a very small side character.
Yeah. So as to flash this back a little bit, if young Dorothy is coming to grips as to why her mother is so imperfect, why did mommy leave me? Why did mommy abandon me? The problem is the wizard, it's because of that.
Yeah.
Yeah.
Wow.
We could write that up. Anybody really a big Wizard of Oz fan? This is a quick letter to the editor for a medical journal. There's more to this. Let's talk a little bit about the Scarecrow, the Tin Man, and the Lion. Because they're clearly figments of Dorothy's imagination, brought upon by head injury. What's going on here? What would you think if someone came to you with a chief complaint of the Scarecrow? What would the chief complaint of the Scarecrow? We just got consulted. 7 Tower. And upon entering that room as a CL psychiatrist and or part of the psychiatry team, I don't have a brain.
Why do you say that? What happened that made you think that?
I don't have one, Doc. Maybe I had one that died off. It just kind of melted.
The
expense of sounding like a broken record, I would go down the delusion path again. with it.
So yeah, it could be like.
What type of delusion is that called?
Semantic.
No? That's a, I mean, that's going to be choice A. There, when you're looking for the single best answer, even though you're not wrong, there's one that's actually better because it's specific to the idea that the individual is either dead or a part of their body is dead or missing.
Oh, there's someone
Here's the C.
Cotard. Yeah. Cotard, C-O-T-A-R-D, Cotard. Right. Similar, Tin Man tells you I have no heart. Cotard. Right. So if these are all manifestations of Wendy's, here I go again. Dorothy's subconscious. She's struggling with the Cotard delusion.
I was thinking maybe more like symbolic of like missing, you know, her missing courage, her feeling dumb, her feeling like she's not, doesn't have attachment and not loved, right? And so she manifests that in like her friends. I mean, we know like the point is that they had it all along. They weren't actually missing these things, and they were quick to understand that at the end. Which makes me feel like it's not delusion versus like we just really poor self-esteem.
So you could easily envision walking into a room, a patient room, and getting that report and thinking, well, where are we here? Is this something that they're talking about that's metaphorical?
Yeah.
If is it not metaphorical? Is this a true and grounded belief? And there's somewhere along that continuum. What will determine where in that continuum the individual is? Because this is exactly what you're going to begin to investigate. And you probably won't be able to ask directly, are you speaking like metaphorically to me, or do you really believe? But you're going to have a conversation, a psychiatric assessment that determines where in this continuum, because you're not wrong. What will get the person to tell you, ultimately, in no uncertain words, I'm not being concrete here. Don't take this verbatim. It's I feel that.
Here's like reality testing questions of like.
You're definitely going to apply those. Definitely. This gets at insight, and one's cognitive capacity to verbalize what they believe or what they feel, right? And think cerebral cortex. If that cerebral cortex becomes compromised for whatever reason, maybe it's due to schizophrenia, maybe it's due to a drug, it doesn't matter. You can see how they're trying to communicate that to you is going to fail miserably. And the report's basically going to be of delusional capacity, right? And it's not just one or the other, there's a continuum here. And insight does wax and wane. So when you come back and say, wow, this was clearly a delusion, and then we walk back together in the afternoon to staff, their insight can be regained, and I could look at you and think, who'd you talk to here? It waxes and wanes. So the fact that she got hit with that window is consistent with some kind of cortical damage. So I'm wondering where in that continuum she is. But the ending does support the idea that she's regained insight. And you know what? From that traumatic brain injury, she is recovered at the end. So there might be that response. Any final thoughts on Wendy? I give up.
In terms of, I think going off Danielle's point, if it's like not Dorothy saying like I don't have a brain, but her saying that my friend doesn't have a brain, my friend doesn't have courage, and it's like displacement or like projection in terms of like a in terms of like a neutral object and her own immature like defense mechanisms, and then that's maybe like a personality disorder or
Isn't that a symptom of schizophrenia? Sometimes schizophrenic patients will say that everyone else around them is having the symptoms that they're having.
It could, yeah. It could definitely project, yeah. Mm-hmm.
You see projection in a lot of things. So, like you can see it in like trauma as well, or like personality disorder and things. You'll see that as well. I think it's just like a defense, of like like an ego defense, right?
Very common ego defense. Yeah. Again, it could go from on one pole completely normal and adaptive to the actual etiology of a persecutory delusion. And someone with established schizophrenia, and then everything in between.
I think it's interesting that she like ends it with the witch melting, right? It's almost like that ego, like a part of her that wants to maybe kill off the people who've hurt her, who like done her harm, but she can't do that in real life. She can do that in her fantasy. Kind of like.
Yeah. Yeah.
Ideation.
Very interesting you brought that up. Because what if in therapy she says that, right? First we'd all think, wow, Daniela, wow, she really, I mean, way back in 24.
Tell me more.
Analysts actually believe that to be the etiology of something. So the defense mechanism is internalization and then killing off the mother object. So this particular condition is largely attributed to maladaptive relationships between children and the overbearing parent.
Eating disorder.
Yeah, this is anorexia. People who actually treat anorexia believe, analysts, right? So not CBT therapists, not physicians, analysts. Internalization, there is so much discord between child and parent that they internalize the parent object and then starve them as a way to symbolically kill them. That's what happens at the end of this movie. Does Dorothy, I got that right that time, have an eating disorder? Is there any other evidence of anorexia in this film? I say that rhetorically, right? But that's something to consider. And just when you're about to say no, looking at the actual diagnostic criteria for anorexia, I want to go back and remind you of what we just talked about just 5 minutes ago pertaining to the etiology of her splitting. Because if there's something there, that could also be that common variable that would certainly provide risk for a future eating disorder. That's early childhood trauma, i.e. the prequel.
And if you think about Wicked as maybe her coming back as an adult looking at it, it's interesting that the melting actually ends up being her way to escape, right? That's how Lubella gets to live happily ever after. So she almost like rewrites her actions in that.
Yep. All right, we're half an hour into it. Any other characters you'd like to discuss? By the way, just by way of just reviewing the entirety of the chapter, there are a couple other conditions I just want to briefly bring up that are published in the schizophrenia spectrum and other psychotic disorders chapter of the DSM. I think two come to mind. One was formerly known as shared psychotic disorder. Right, so what is that? Okay, what is that?
A shared delusion between two people.
Right. Treatment?
Isolate the one who's actually having the delusion.
Yeah.
And then the other one should stop.
Exactly right. Prognosis?
Good for the other person. Bad.
It's poor only because it's almost impossible to maintain that distance because it's usually family, right? It's usually family. So even though the initial separation does in fact work and there's a high likelihood of it working, it's very rarely sustainable. So overall, it's a poor prognosis, right? But again, this is a condition in which an individual with no sign of mental disorder begins to incorporate content of a delusion of someone within which they're close contacted, and it's usually a family member. The treatment is not antipsychotics, it is separation, but it does have a poor prognosis. The other condition that is published in this chapter, or at least it's fleshed out in this chapter, is catatonia, right? So again, if you want to just review that for your exam, catatonia. Catatonia, generally speaking, primarily focuses on an individual's not interacting with their environment or having some abnormal motor movements or motor deficit. All right, so that's the general definition of catatonia, the specific signs and symptoms of which you could review and should review prior to your exam. Catatonia could be a standalone illness, or it could be a manifestation of an underlying mental disorder. And of course, anytime you think that, you always have to rule out the direct and physiological effects of a substance, and in this case, especially a general medical condition, including neurological conditions. What is the bedside test, diagnostic test for catatonia? Yeah, right. So usually lorazepam, and it's provided through the IV. And individuals usually are provided a structured assessment like a Bush-Francis catatonia scale, and that score should reduce by 50% upon getting that benzodiazepine challenge. All right. I think that fairly covers the schizophrenia spectrum and other psychotic disorders chapter. Any other characters you want to discuss in our closing comments?
Tin Man,
What's going on here?
like hopelessness, kind of like loss of pleasure, kind of loss of goal-directed behaviors, kind of like a major depressive picture with like kind of like an anxious like personality trait as well, and you know, I don't know, like I felt like the way that he interacts with the group, like he just comes off very like paranoid and like anxious, hopelessness. Yeah.
Let's say he has established depression. Let's say the Tin Man presents with a chief complaint of whatever. And upon initial assessment, you believe he reaches clinical criteria for a major depressive episode. You know, one of the things that goes into the assessment of depression, and sometimes it's not the initial assessment, but it's one that certainly appears on board exams, and that is to evaluate for subtypes. Right? Because I think the Tin Man actually demonstrates not one, but several. Right? So what are the subtypes of major depressive disorder?
Like specifiers, you mean?
Well, there's multiple specifiers. There's duration specifiers. This is the subtype specifier.
Okay.
With psychotic features.
All right, so psychotic features, yep.
Or like atypical depression.
Atypical, good.
Anxious distress.
Anxious distress.
How many more are there?
4.
Okay.
Like,
Is there like a
So seasonal.
Seasonal.
Dysthymia.
Just persistent depressive disorder, or that's PDD.
Oh, that's totally different.
Recurrent?
That's the core specifier.
Postpartum.
That's more of a core specifier.
You're not putting premature for referred. Okay.
No. Catatonic. Melancholic. Mixed, meaning that there are manic features that don't rise to the level of a manic episode in terms of definition. Manic features, but not a manic episode.
How do you distinguish that from hypomania?
Because of the number. Hypomania, you actually do need 4 or 5, right? Depending on if your mood is irritable versus elevated/expanded. Yep. If you have 1 or 2, in the context of depression, we're going to call that mixed. If you have 4, in the context of depression, we're going to call that bipolar. Bipolar 1. Depending on duration. Right? And severity.
Severity.
Yeah, severity. What you just named for me is an acronym CAMPS, C-A-M-P-S. Right? There are 2 A's and there are 2 M's, but otherwise catatonic, atypical, anxious features, melancholic, mixed, psychotic, seasonal. CAMPS. How many of them are demonstrated by your observation? You named, I think, 3 or 4. So I'm not going to ask you to rename them. Let's see if everybody else was listening.
We definitely covered anxious.
Definitely anxious, right? You said he was anxious.
Mhm.
So if in the context of a depression, maybe it's major depressive disorder with anxious features.
Does the
Anxious distress.
Does the hopelessness make it melancholic?
Hopelessness doesn't. I would need to see a preponderance of symptoms in the morning and significant anhedonia. I'm not sure that's there.
It's pretty atypical because he's still like out doing stuff and like it's not all the time. It's like here and there.
Hypersomnia, increased appetite. Now here's one, leaden paralysis. Right? Now, here's the trick though. If we're going to say yes, metaphorically, we can't say also catatonic because he looks catatonic to me. So I think it's one or the other, but it's definitely at least one of them, right?
There's a movie activity for atypical depression.
Yeah, that's what I was
Yeah.
thinking of that.
Yeah. Does he have movie activity?
He's like happy at the end when he gets what he wants.
Yeah. He's even kind of happy when they like unfreeze him. He's like, oh, thank you.
Okay. So
He's having a good time.
we'll go with atypical over catatonic. Psychotic, I mean, he's got the delusional belief that he's missing his heart, so we're okay with that. I'm trying to think, what season does this take place? I mean, it's usually shown around Thanksgiving, so.
Oh, that way you think it's
So, I mean,
So when
Like
the tornadoes
one
hit in the summer,
Oh, yeah, when the
Twister.
tornadoes
Yeah,
Tornadoes
yeah.
hit in the summer usually.
yeah, so I'm not sure we can buy
And
that.
so they have like the Omaha kind of like state fair according to the bubble or the
Oh.
balloon things. I would think
Right.
it's like summer probably.
Yeah, so we're not going to go with seasonal then. So there's definitely 3 here. Interesting. There's actually 3 subtypes you can learn through the Wizard of Oz, specifically the Tin Man.
Which actually, if we talk about the wizard real quick, we found
Yeah.
out that he's a human who apparently like served in some kind of war. He talked about how he had like previous experience fighting and like that's why he knows what real courage is. And he apparently like escaped the real world to be here and like manipulate everyone and do what he wants before flying off back to reality. Like what is that? Was it like PTSD with you or like?
What do you think? I actually have a working diagnosis
Oh, you
here.
do?
Yeah, I do. I think it's pretty strong, if I may say so myself. And I didn't think about it until you mentioned it.
Okay.
Right. So this is completely ad-libbed here. Any thoughts here? So what are you thinking when he sits down and is telling us the things that he's telling us? I want to know what's going through your mind.
Dementia.
Huh? Why dementia?
History of trauma, the war, it's like, and so the military service is a high incidence of TBI and PTSD, which is slightly more significant for development of dementia. His age, and just like, he's a male, which is also a higher risk for dementia, but also like his weird beliefs and like hallucinations.
Let's go with that. I'm looking at the content. What about the content of what he's telling us? What's going through your mind? It's not going to be blank. You guys are medical students. There's no way your minds are blank.
Flood of association.
Huh?
Flood of associations.
Okay.
Is he like narcissistic?
Yeah.
It seems like narcissistic, right? Why?
It's all about him being a hero and him being controlling everything.
Do you believe him?
Not really.
Right. What do you think you might? What's going on here? So back in the I guess it was like the 1800s. There was somebody who fought in a war that would keep his troops morale up by telling these miraculous stories that sounded an awful lot like the wizard. A lot of people thought that he had dementia or some sign of severe mental disorder. This was a German national that fought with the Russians against the Turks. Other people think that he was completely normal and made it all up just to have his troops' morale up in terms of the way to get them prepared for battle. His name was Baron Friedrich von Munchausen.
Oh my god.
Right? And obviously the disorder, Munchausen's disease, was named for him, currently known as factitious disorder. So if you read The Adventures of Baron von Munchausen, and by the way, it's one movie that I wouldn't necessarily overly endorse. The book is much better. And one of the reasons why the book is so awesome is that there are some chapters that are literally 1 paragraph long. They're just excerpts of his stories. Some are, long, 10 pages, and some are literally a paragraph. They're incredible. If you have any interest in psychiatry whatsoever, reading them will put a smile on your face. And reading them, having watched The Wizard of Oz, I think will have a meta. I think you'll really enjoy it from a meta perspective. So check it out. I don't know if the wizard actually has factitious, but boy, do I want to work him up as that just because of how eerily similar he is to the Baron. All right. We'll end it there. All right. We'll end it on that very high, funny note. Any last second thoughts or final questions? We're good. All right. So I think we're off next Friday. So we'll pass on any assignments with regard to film or Seinfeld. Thank you.
Apparently in Germany.